There's a new way now to search for information on coronavirus cases at local nursing homes. The federal government says nursing homes around the country are required to report COVID-19 information to the CDC, and that information is now public. Here's some of what it shows around Northeast Wisconsin. These are numbers about residents at nursing homes. It shows that Bethel Home in Oshkosh has reported 13 cases, no deaths. Eden Rehab Suites and Greenhouse Homes, also in Oshkosh, reported 1 case and 1 death. And 3 other nursing homes in Northeast Wisconsin have each reported 1 case and no deaths. Those are St. Francis Home in Fond du Lac, as well as Rennis Health and Rehab Center in Appleton, and Pines Post Acute and Memory Care in Clintonville. But according to that new database, more than a half dozen nursing homes around Northeast Wisconsin have data missing, with those nursing homes not meeting the last 2 deadlines to send in that information. Tonight, we're asking why. The new federal database includes nursing home information on confirmed coronavirus cases among residents. We're focusing on nursing homes the database says missed 2 deadlines for sending in data. Those include Kewanee Health Services in Kewanee, Green Bay Health Services in Green Bay, and Maple Lane Health Services in Shawano. All 3 are North Shore Healthcare centers. That company, North Shore Healthcare, is based in Glendale, north of Milwaukee. The company sent a statement that says, in part, while the system was showing a lack of reporting for some of our centers in the greater Green Bay area, this was not due to a lack of effort to uphold transparency and compliance through reporting. The statement went on to say that 2 of the 3 centers have since reported, while the 3rd center has a registration issue that they're working on getting fixed. A separate nursing home that's missing information, according to the database, is St. Paul Elder Services in Kaukauna. But St. Paul CEO Sandra Norder says that is not true because they have sent in the information. She sent us screenshots that she says show the reporting system from their end, with a legend saying green means record complete. But with the public database showing something else.
It doesn't look good for us, which is frustrating when we have worked so hard to meet these expectations and these reporting requirements. But I'm not going to let it bother me too much because we have been more than transparent about everything that's happening in our facility here.
Norder says they had 1 coronavirus case in their nursing home, a person who has fully recovered. Elsewhere, the Brown County Community Treatment Center Bayshore Village Nursing Home is also listed as missing information. It's owned by Brown County. The executive director of the county's Health and Human Services Department said it's a technical issue and they're working on getting access to the system, adding they have not had any confirmed COVID cases among residents. As far as whether or not those North Shore facilities have had any confirmed cases, they did not get back to me on that. Now, we reached out to the federal agency that published the database. A statement we received back says, in part, as with any new reporting program, there can be data submission errors in the beginning. In an effort to be transparent, CMS, that's the Centers for Medicare and Medicaid Services, made the data collected by the CDC public as quickly as possible, balancing transparency and speed against the potential of initial data errors.